On May 29, 2009, I delivered our boy-girl twins, Grayson and Lola. It was the best day of our lives. They were born premature at 32 weeks, yet, as with all premature infants, they needed to stay in the neonatal intensive care unit for a few weeks to grow and to mature. I was scared, being a first-time mom. The NICU is an intimidating place, but Alan worked there at the hospital, one floor below, and he could be at their side at any moment.
I was happy the babies were delivered at the hospital where I worked. Cathy and I got to know the nursing and medical staff and enjoyed being involved in the twins' daily care. We spent as much time as possible with them, even sleeping on the fold-out couches just to be close to them. We became those parents that just wouldn't leave. Grayson and Lola seemed to be doing fine, and we were adjusting to the daily life in the NICU. On June 4th, I attended rounds where a resident expressed concerns about Lola's condition to the attending physician. She stated that overnight, Lola had developed some decelerations in her heart rate, changes in her breathing pattern, and was not feeding as per the protocol. But the attending assured her that this was normal activity for premature infants, and there was no need for concern. I felt comfortable because of his years of experience, and I went about my normal day.
June 4th was the only day I didn't go to the hospital. The staff had expressed to us the babies were doing well. They encouraged me to stay home and get some needed rest because there wouldn't be any once the two babies came home. Of course, I still called the hospital numerous times throughout the day to make sure they were all right. When I called that night, a resident told me Lola was experiencing signs of something called necrotizing enterocolitis and had been intubated. She told me not to worry, Lola was comfortable, and to go back to bed. But we thought, no. Then we rushed to the hospital. When we got there, we were met by a resident and fellow doctors in training. When I saw my daughter's appearance, I couldn't believe this was my same precious baby who was fine just hours earlier. Throughout the night, Lola's condition worsened. I remember the look of horror on the fellow's face when he realized the antibiotics he had ordered hours earlier had not been administered yet. Or the lecture I was given when I demanded these young doctors call the attending physician. At another point, I was screaming for someone to find a scalpel when the doctor realized there wasn't one on the emergency tray. Then finally, I remember them passing me my daughter and asking if I'd like to hold her as she took her last few breaths.
Cathy and I were devastated by Lola's death. I struggled on how to be a grieving father and remain a supportive husband, all the while having to push away the feelings of anger and guilt I felt about what happened at my hospital. Too many things had gone wrong that night, but I kept telling myself that bad things happen at hospitals, and this time it happened to us. It took months for me to finally sit down and go over Lola's medical charts. The more I looked, the more obvious it became Lola had shown signs of an illness days before her death, and nothing was done to prevent its progression. She died of a series of missed communications, misdiagnoses, and medical errors. Lola had become one of the hundreds of thousands of lives lost in the United States each year due to medical mistakes.
Alan often reminds me, even if every single thing would have run perfectly that night, our daughter still may not be alive. But what we do know is she deserved better. Her brothers deserve to know every possible thing has been done to understand and rectify the circumstances that took their sister. They need to know when they go into a hospital for any type of care that they are safe and they are protected. We were torn between our grief over Lola, our anger at the hospital and each other, and our love for Grayson, Lola's twin brother who needed us. Finally, together, we made the choice to share Lola's story to educate healthcare providers on preventing medical errors and encouraging families to speak out for their loved ones.
We do not share Lola's story for sympathy or to place blame. Lola not only changed me as a father, but as a healthcare provider. Her death is a true example of the impact preventable medical errors have on families in the healthcare system. We want to evoke change and are asking others to become part of the movement, decreasing the amount of medical mistakes occurring in our hospitals each and every day.
As a vocalist, I know music has the power not only to entertain, but to heal and to teach. we developed Lola's Song Project to honor our daughter. It's an innovative way to encourage healthcare providers to work together across interdisciplinaries to create a message that's memorable. Focusing on skills like effective communication, escalation, teamwork, and empathy, participants leave more mindful of their actions and thoughtful of their patients. Lola's story and Lola's Song Project will inspire you to provide the best care for every patient every day. Stopping medical errors begins with you.